evening and a very warm welcome to all of you in this evening interactive session of ours where we generally take a topic with you. Today is a very special topic which many of our viewers they regularly ask us to take, and the topic is multiple sclerosis, a disease which is now becoming very common in today's era. A disease where the nerve fibers, the nerve cells, the outer myelin sheath of the nerve fibers, that starts damaging up, and as the nerve gets damaged, there are various symptoms that can occur over here in a patient suffering from multiple sclerosis, like numbness and tingling that affects the arm, legs or one side of the face, uneven balance and weak legs. Very important one, double vision, blurry vision in one eye or partial vision loss. So such is the intensity of the disease that it can also cause partial vision loss. If we talk about the pathology of multiple sclerosis, that what exactly happens when a patient is suffering from multiple sclerosis, you can see a normal nerve cells and how in a patient suffering from multiple sclerosis, the normal nerve cell, it is damaged, it's not the same which otherwise it remains. And when I compare nerves, I generally in a layman language always guide my patients that we can compare our nerve cells like electricity wires. Just like a main switch gives electricity supply to various parts of a room, and the appliances they are lightened up, and if particular wires carrying that electric current are damaged, for example if their outer rubber coating is not there, it will cause short circuiting. So that is something which happens in a patient suffering from multiple sclerosis. When the nerve fibers they are damaged, the signals are not properly conveyed, and that leads to a number of agonizing symptoms. So I'll be taking some symptoms of multiple sclerosis, like since it affects the central nervous system which controls all the actions in the body, symptoms can affect any part of the body. Lhermitte's sign is a very common sign in a patient suffering from multiple sclerosis, and in that sign a person may experience a sensation like an electric shock when they move their neck, known as Lhermitte's sign. Then also there is spasticity and muscular spasms. Now that is something which is very common, which is an early sign of multiple sclerosis. Damaged nerve fibers in the spinal cord and brain can cause painful muscle spasms, particularly in the legs. Now generally if we are having any kind of cramps in the legs or spasm in the legs, if we do excessive walking, a new kind of exercise, we may have that kind of spasm in our legs. But a patient suffering from multiple sclerosis will have that spasm without any obvious reason. Going further in the symptoms, the person will have pain, muscle weakness, numbness and tingling, bowel incontinence. Now that again is a problem. A person who is a patient of multiple sclerosis will have bowel incontinence. He won't be able to control the natural urges of defecation, urination. Then emotional changes and depression are a very common feature, and then learning and memory problems are also there when a patient is suffering from multiple sclerosis. So it is an important disease, it's a crippling disease, and it needs to be taken very carefully, because in allopathy when we talk about multiple sclerosis, there is nothing much that can be done. Not much help is available for multiple sclerosis in allopathy. And how the diagnosis is made. Now diagnosis is very important over here, and when a person is diagnosed for multiple sclerosis, it can be diagnosed by neurological examination and brain MRI scans. Then family history is also taken care of, and lumbar puncture is done. And when a person is given a lumbar puncture and a CSF analysis is done, the cerebrospinal fluid analysis is done, it is noticed that IgG, which is the immunoglobulin which otherwise is for fighting the infections which are coming from outer world, that IgG is in a greater level in a patient suffering from multiple sclerosis. So these are the signs and the diagnosis of multiple sclerosis. Now if we compare the nerve cells, you can see a normal nerve cell on one side and the multiple sclerosis nerve cell on the second side. You can see how the outer covering of the nerve cell is damaged in a patient who is suffering from multiple sclerosis. So as I said, in allopathy, although steroids are administered for a patient suffering from multiple sclerosis, but unluckily the prognosis is not very good, and patients of multiple sclerosis, when they approach us, they already are in extreme stages of multiple sclerosis. Many of them are even bedridden. So in Ayurveda, when we talk about multiple sclerosis, what exactly is multiple sclerosis in Ayurveda? So here in Ayurveda, the multiple sclerosis is known as Vyan Vayu Dushti. Vyan Vayu Dushti. I'll be coming to your questions also, Hemrajji and all others who are there with us. Please be with us and I'll be coming to your questions very soon. So when we talk about Vyan Vayu, Ayurveda believes that there are 5 kinds of Vayu in the body. And out of those Vayus, the Sarvang Sanchari Vayu, it is said that Vyanen Ras Dhatu hi Vikshapochit Karmna Yukpoto Sarvato Jasram Dehe Vikshipyate Sada. Vyan Vayu is a Vayu which gives its effects throughout the body, and multiple sclerosis is a disease where Vyan Vayu is vitiated. And when we talk about a patient suffering from multiple sclerosis, there are lot many Vayu pacifying herbs, Vayu pacifying minerals, which if given to a patient suffering from multiple sclerosis, the recovery starts right from the very first week itself. Now some home remedies for it. Rason Kheer Pak, garlic. Garlic has to be boiled and cooked in milk with the Rason Kheer Pak method, and that kheer, which is milk, is to be taken regularly, at least 1 time in a day, and it gives a very miraculous recovery in a patient suffering from multiple sclerosis. Second thing is Nasya. What exactly is Nasya? I'll be showing you the image of Nasya. This is Nasya being done at one of our centers. You can see how the oil is being administered in the nose. Now this is a method which is really very good one for all neurogenic problems. This Nasya is one of the procedures that is very good for a patient of multiple sclerosis. The second one, as you can see, a patient lying down in an apparatus where medicated decoction is being used to provide the person with steaming to his complete body. So that is Sarvang Swedanam. The third one, Shirobasti. You can again see a collection of medicated oil on the scalp of a patient. It gives very good recovery in a patient suffering from multiple sclerosis. Shirodhara, that again is something which many people nowadays go for. Dhara is again a procedure which is very good for a patient suffering from multiple sclerosis. Along with these things, the Ayurvedic combinations like Brihatva Chintamani Ras, Ras Raj Ras, and other Vayu pacifying combinations, if given under the guidelines of a trained Ayurvedic doctor who is expert in giving treatment to a patient of multiple sclerosis, the results are miraculous. From our end, you are having our helpline numbers. You can always post your reports, your details, your signs and symptoms on these numbers. You can use WhatsApp, you can mail it to us, you can give us a call on 24/7 helpline numbers, and my team shall be guiding you the best resolutions in multiple sclerosis.